So when I talk to patients about ScarWork, the way that I explain it is really based on everything that I've learned in your class and maybe a little bit that I've learned in school, about tissue, because I guess I'll talk about the piece from chiropractic that, it only takes like 20 minutes to form an adhesion if things are not moving. Yeah, so
cool.
It doesn't take very long at all.
No.
But when a surgeon opens up a body, or if you have an injury that splits the body open, the body opens and it's exposed to air, and then that tissue says, it starts to form a scab. Basically, stop the blood flow. So when the surgeon or the doctor closes up the wound, that tissue is chaotic in there. But they've just closed it up. They haven't normalized it. So now you've got abnormal kind of chaotic tissue underneath there, and they've cut through nerves too and things. So they close it up, and what the ScarWork does is if you push on the scar hard, you're just kind of moving the whole tissue out of the way. But if you lightly rub it, you're melting it. And why I say melting it is because the scar connective tissue does not form chemical bonds. It forms hydrogen bonds, which are very weak bonds. It's an adhesion, in other words. Yeah, hydrogen bonds. It's a magnetic bond. It's a magnetic bond. Literally.
Oh, really?
Literally.
Oh,
Yeah.
my God.
Yeah. So when you're gently, using your warmth and movement, you're gently literally melting those adhesions. And then the tissue comes back together based on DNA. It's not going to do something that's not based on DNA. And it stops when it gets to DNA. That's your teaching.
Yeah, that's what I see.